Hey y'all, it's November the 26th, 2015, and I came across this here magazine. It's called In Touch Magazine. It's like any other retarded magazine for retards that you'll find anywhere. Say Dollar Generals, Walmarts, HEBs, any kind of store. You're gonna find magazines like this. They're marketed towards retards. And this one particular one is about obviously Charlie Sheen and his deadly HIV lies. Anyways, um, if you can get a hold of this magazine, you can flip towards this page. It's actually page 14. Right here, what you're going to see is celebrities who are retarded, uh, namely George Clooney. You got Jennifer Lawrence down here, some other retard celebrity who I don't know her name, and I don't know this lady's name either or that boy's name, but they're all retarded and they're making retarded faces. Narcissistic retarded faces, and that's what it is. But like I said, this is a magazine that's marketed towards people who are retarded, so they know that people who are retarded are going to buy this magazine, right? And now here, right here, is an ad for any generic vaccine that they're pushing on. Yes, you guessed it, retarded folks. They know that you're retarded if you bought it, and they know that you have a baby if you're seeing this. All right, so they're targeting retarded folks with babies. Now, this particular vaccine, is for invasive pneumococcal disease. All right, you probably haven't heard of it. The reason being is more than likely a pretty rare disease. Now, the disease itself could prove to be deadly in some situations or pretty harmful in some situations, but like I said, it's also quite rare. Now, this vaccine, I'm going to go over it with you because, like I said before, and I'll say it again and again and again, I'm not anti vaccine. In fact, nobody's anti vaccine. Only people who are anti vaccine are retarded people. All right. I'm just anti bad, horrible vaccines that hurt little children, and most of them do, especially the ones that have ads in magazines that are marketed towards retarded folks. Now, this one right here is called, let's see if we get a close up. It's called Prevnar 13. Now, you might as well just call any general vaccine that they have on the market today. And let's just, here's what I'm going to do. And what I want to explain is if you have eyes and you can read, and you're not a retard, chances are you don't come across this magazine. But say if you're like me and you're a normal person, you might come across this vaccine and you're going to notice some things that are quite concerning, quite concerning. So I'm going to go over those things. It's gonna have a lot of words, and if you just simply use common sense, you're going to be able to figure out that these words are quite concerning. And let me go over it for you real quick. If you got a copy of the magazine, you can go along with me. Uh, here's the first paragraph. Invasive pneumococcal disease spreads through the air with a cough or a sneeze and can cause meningitis and lead to brain damage or even death. Now, this is very rare cases, but they want to get you scared. Real scared because they know you're retarded and they know you're going to act on your fear. All right, Prevnar 13 can help protect against IPD in children 6 weeks. Now remember these numbers, 6 weeks through 5 years of age as recommended by the CDC. We know how trustworthy they are. It is important that your baby completes all 4 doses. They must complete all 4 doses, and it's important at 2, 4, 6, and 12 through 15 months of age. Now they want first of all, see, you're gonna notice how the numbers are quite confusing because at first they said 6 weeks to 5 years, and then they said it's important that they get all the doses before they're 15 months old. Now, is it 5 years or is it 15 months old? Because that's a very big time gap. All right, it's very confusing. Prevnar 13 is a vaccine approved for children 6 weeks through 17 years of age. Wow, 17 years of age now. All right, is it 5 years or is it 17 years or is it 15 months? It's all quite confusing. It's meant to be that way. For the prevention of IPD caused by 13 Streptococcus pneumonia strains. And for children 6 weeks through 5 years, now it's 5 years again, for the prevention of otitis media caused by 7 of 13 strains. And then, just like most of these other vaccines, pretty much all these other vaccines, it's going to say Prevnar 13 is not 100% effective. I repeat, not 100% effective. Later on in their little advertisement slash side effects, they're going to mention that there's actually 6 other strains that it does not prevent against. All right, so it's not even close to 100% effective. They say it's not 100% effective, but the fact is it's not even close to that. All right, and will only protect against 13 strains, even though there's 6 strains it doesn't protect against. All right, Prevnar 13 should not be given to anyone with a history of severe allergic reaction to any component of Prevnar 13. First of all, they're not going to tell you what are the components. And if you go to a doctor or a Walgreens or anything else, they're not going to tell you one single component that's in the Prevnar 13. They're just not going to do it. So let's take this situation into consideration. You have a 6-year-old baby, you're retarded, you bought a retarded magazine, they told you to get your baby, your 6-week-old baby, some shots. All right, how in the world are you going to know whether or not your 6-week-old baby is allergic to any of the ingredients that are in Prevnar 13 when you have no idea what's in Prevnar 13? Are they going to do tests to make sure that your baby is or is not allergic? No, they're not. They're going to pump your baby full of Prevnar 13, and you're going to roll the dice on that. All right. And then it goes on just like many other ones, and it says children with weakened immune systems may have reduced immune response. Now, what that means is if like they have HIV or leukemia or something else, it's going to be a very, very bad idea to give them Prevnar 13. But if you just stop and think about that for 2 seconds, what you're going to realize is if it hurts someone with a weakened immune system, then it also hurts someone with a strong immune system. The thing about it is you're not going to tell as much with someone with a strong immune system, but please believe it's going to hurt them either way. Either way, it's going to hurt them. So that doesn't sound very good, does it? Uh, a temporary pause of breathing following vaccination has been observed in some infants born prematurely. Really? A temporary pause in breathing? That sounds fairly serious. I mean, how long is this temporary pause of breathing? What the hell do you mean, temporary pause of breathing? What does that mean? Does that mean they're dead? That they're dead? I don't know. It doesn't really talk about it that much. The most commonly reported serious adverse uh, events in infants and toddlers would be bronchiolitis, which I have seen myself happen and stuff. It's not very fun. All right, but but it is common. It's commonly reported though. Bronchiolitis, gastroenteritis, and pneumonia. All right, so you had a healthy baby, you're a retard, you bought a retard magazine, you got your baby shot, and now your baby has pneumonia, which is commonly reported, and it says it right there on the page. All right, in children 6 weeks to 17 years, the most common side effects would be tenderness, redness, and swelling at the injection site, irritability, decreased appetite, decreased or increased sleep, or fever. All right, and then it says, ask your healthcare provider about the risks and stuff, even though, you know what I'm saying, we're telling you all the risks right here on this page. All right, then it has a whole, I mean, check this out, all this fine print, you know what I'm saying? It doesn't tell you what's in it, but it will tell you all about sorts of side effects and things, just like I was saying, a temporary pause in breathing. A temporary pause in breathing after you take it, that's commonly observed, especially in preemie infants and stuff. I don't know why you're shooting your preemie infant all up with stuff other than maybe that you're a retard and you bought a retard magazine. Um, Decisions about when to give Prevnar 13 to infants born prematurely should be based on consideration of the individual's infant's medical status and the potential benefits and possible risks. I mean, the thing is, the potential benefits, what are you having your preemie infant child around all sorts of people with invasive pneumococcal disease? Why are you doing that? Why are you doing that? To the point where you have to shoot them up and stuff in order to save them. What you should do is keep them away from invasive pneumococcal disease. Keep them away from people who are coughing all over them and seem to be dying because of it. All right. What are the potential side effects? And like I said, those are the ones that I already mentioned. They want to go ahead and repeat it, but of course, the serious ones would be bronchiolitis, which I've seen myself again, gastroenteritis, and of course, pneumonia. You know what I'm saying? So that is what you're dealing with, and then if you read, you're going to see all sorts of. They want to give it to old folks too, just in case their immune system's doing well. They want to mess with that, and of course they're going to mention again, Prevnar 13 is not 100% effective. Repeat, not 100% effective, and will only protect against 13 strains, and absolutely won't protect against 6 other strains. And I forget where it is and stuff, but it also says somewhere here on this back page that if you get another vaccine, say if you were to get a previous vaccine and then you get the Prevnar 13 vaccine within about a year's time, that's actually a horrible, terrible idea and will fuck your shit up. It will fuck it all the way up. And then I also remember reading, and you'll be able to find it in there. It says, because here's the thing, just like most of these other vaccines, it will cause a high fever, especially in your young children. All right, and so what a lot of people do is they try to stifle that fever, and what a lot of people will do is give their little baby child acid methamphetamine. If you know what I'm trying to pronounce, acetaminophen. All right, in order to take down the fever. Now, if they were retarded and they didn't read this piece of paper and they didn't ask their doctor, or their doctor in fact lied to them, um, what they wouldn't know is that you absolutely shouldn't take acid methamphetamine before you take the Prevnar 13, because that will fuck your shit all the way up. And they, in fact, warn you on this piece of paper. In fact, what you should do is take it afterwards, because for some reason, if you take it before, it will fuck your shit all the way up, especially in your little babies. So, anyways, I'm going to go ahead and end it like that. This is just another general. Vaccine that's marketed towards retarded folks, and it has a baby who's mad concerned about invasive pneumococcal disease, and it's scaring the bejeepers out of you because you're retarded, and they're going to go ahead and capitalize on that. And also, it's really, really kind of a bad idea. So this is November the 26th, 2015. I hope I helped some of y'all who aren't really retarded out there. Y'all have a good one.